Hello everyone, myself Dr. Abdul Salam. I did my MBBS from AIMS New Delhi. Currently I am doing second year junior residency in National Institute for Mental Health and Neuroscience NIMHANS. Today I am going to talk about COVID-19, its clinical features, myths, how to prevent spread of COVID-19. So COVID-19 is the name of the disease. It is caused by coronavirus. Coronavirus is a large family of virus. It is present in humans, mammals, birds. It is transmitted between animals to humans, then humans to humans. There are 7 types of coronaviruses. 4 species, they cause common cold-like symptoms. One, other is SARS. It was present in China in 2002 to 2003. The mortality rate was 10%. And MERS, Middle East Respiratory Syndrome virus, with the mortality rate was 40%. The 7th one, the current SARS-CoV-2, the name of the current virus. Why there is a novel coronavirus likely to emerge periodically? Because there is a wide distribution, the genetic diversity, increasing human and animal activities. So there were clusters of pneumonia in the Wuhan, China in the end of the December. The epidemiologically it is linked to seafood and wet animal wholesale market in the Wuhan. The hypothesis was in that Wuhan market, apart from this seafood, there were many animals, birds, including bats. They are also selling. Today, 29th March 2020, the cases is present almost in all countries. About 6.84 lakh cases are there. Apart from this 6.8 lakh, there are 1.5 lakh cases are recovered from the disease. Unfortunately, about 32,000 people are died due to this illness. So what is the clinical severities of COVID-19? 80% symptoms are mild, recover within 2 weeks. 15% case become severe, they should treat in the hospital. 5% patient become critical, they need ICU and ventilatory support. Many of these critical patients, most of the people are grouped under this. They may be older, having some comorbidity like diabetes mellitus, hypertension, cancer, cardiovascular illness, respiratory problem. What are the clinical features of COVID-19? Fever, 90% of people having fever, 70% dry cough, 40% fatigue. And this apart these 3 symptoms, 2 will be there 100% of the cases. And there will be sputum production, shortness of breath, that means breathing difficulties, sore throat, myalgia mean muscle pain, arthralgia mean joint pain, diarrhea and headache. This fever, dry cough, difficulty in breathe, that's a very important symptoms. Case fatality ratio, that means out of 100 people, how many people will die due to this illness? We can say this around 7 lakh case, 32,000 people are died. That means less than 5% overall case fatality ratio. But there will be case fatality ratio will be higher in comorbid condition like cardiovascular disease in 13%, diabetes 9%, hypertension 8%, respiratory disease 8%. Incubation period. This is the period from infection to symptom. That means one person getting one virus, coronavirus, and after how many days that person showing some this symptom, COVID-19 symptom. So 95% of people, this incubation period is 1 to 14 days. That's the reason why we telling that quarantine period is 14 days. We are waiting 14 days to whether symptom was coming or not. Time interval of symptoms. The first symptom, the fever usually come the day 1. Dry cough usually come day 4. If person become more severe, shortness of breath in the day 5. If person become critical, acute respiratory distress syndrome, ARDS, usually come 6 to 12 days. Where it is coming from? As I told earlier, in the Wuhan market, the hypothesis was they were selling bat also, so it is originating from bats. Its nucleic acid, its RNA, its genetic material is more similar to bats. So most important, how it's spreading from one patient to another person. There are two methods. One is droplet transmission. Second is direct contact with formate. Droplet transmission means through one patient is coughing, sneezing, talking to another person in close contact. This virus is released through this process, and this virus is usually do not travel more than 2 meters. So it will reach to another person, and another person's mouth, nose, eye, it will reach its respiratory tract, and it will cause virus replication, virus multiplication, later COVID-19. Another thing, direct contact with formates, touching this object surface where this droplet land and touching this hand to eye, nose, mouth. Most important, when patients are more contagious, when they are symptomatic. Who is eligible for getting this COVID-19 test done? According to ICMR, Indian Council of Medical Research, 5 people should then test. All symptomatic people, that means fever, cough, difficulty in breathing, they have undertaken international travel in the last 14 days. All symptomatic contact of laboratory confirmed positive cases. All symptomatic healthcare workers, they have treated, they have interacted with the COVID-19 cases. For all hospital patients with severe acute respiratory illness, they having fever, cough, difficulty breathing, etc. The 5th one, all asymptomatic, they all are asymptomatic, direct and high risk contact of confirmed positive case. They should do test the contact 5th day to 14th day of contact. Who is direct and high risk contact? These people who live same household of positive case, or healthcare worker who examine patient without adequate personal protective equipment as per World Health Organization recommendation. What are the public health outbreak response tactic? Most important, isolation. When a patient is diagnosed positive COVID-19, you should isolate in the ward or in the designated place. Quarantine. When you coming traveling from foreign countries, when you coming from a suspected COVID-19 place, when you have some contact with some COVID-19, if you have some doubt, You go quarantine for 14 days. 14 days mean the incubation period. Social distancing, community containment. The most important of my this slide, what can I do to protect myself and prevent the spread of illness? Regularly and thoroughly clean your hand with an alcohol-based rub or wash them with soap and water. Maintain at least 2 meter distance between yourself and anyone who is coughing or sneezing. Avoid touching eyes, nose, mouth. Make sure you and people around you follow good respiratory hygiene. What is mean by good respiratory hygiene? When you coughing, sneezing, you should cover your nose and mouth with the elbow, and you should cough and sneeze to the elbow. Stay home if you feel unwell. If you have fever, cough, difficulty in breathing, seek medical attention. Avoid traveling to place, especially where COVID-19 is spreading. How long does the virus survive on surface? Coronavirus may persist on surface for few hours or up to several days. This may vary from under different conditions. Example type of surface, temperature, humidity of environment. In the air, it will live up to 3 hours. Cardboard 1 day, stainless steel 2 to 3 days, plastic 3 days. If you think the surface may be infected, clean with simple disinfectant to kill the virus and protect yourself and others. Thank you. Any questions?